guys, it's Sarah. In this video, I'm going to be talking about different job options for nurses. So let's get started. So the first thing I'm going to be talking about is, like everyone knows, your bedside nursing. So this is usually in a hospital. It's usually 3 days, 12-hour shifts. You could do nights, you could do evenings, you could do days. But usually it's 7 to 7 or 7 to 7 the other way. There are many different floors you could work on in a hospital: geriatric, pediatric, ICU, ER, OR, dialysis. You could do OB. There are many different floors you could work on, and that will be a separate video determining which floor is for you. And they're all different, but it's basically the same inpatient. You're taking care of the patients who are acutely ill, and every floor has their ups and downs, but that will be a different video. The next type of job you could pursue as a nurse is school nursing. So school nursing is you're working in a middle school, elementary school. You could even be working in a private school. And what you're doing is you're taking care of relatively stable, it's basically your kids that you're taking care of. So usually these kids just need basic first aid, a Band-Aid, their belly hurts, and they're tired, they fell down during recess, basic first aid. But you also have your patients who are asthmatic, seizure patients who you want to pay more close attention to. The good thing about school nursing is that if you're a mom or if you just want short hours, it's great because you generally are working the school hours, so you're off after 3 or 3:30, whatever it is, and you're home to pick up your kids or go home with your kids if they're in that school. And also you're off during the summer. So this is good and bad. It's good because you're off during the summer, you could do camp nursing, or you could just relax. It's also not so good because you're not getting paid as much, because they're only paying you for 10 months a year. The next type of job a nurse could go into is nursing homes. So nursing homes is the opposite of school nurse. In school nurse, you're working with the young. In the nursing home, you're working with the elderly. So in the nursing home, there's very different roles that everyone takes. So the CNA, you're on top of a CNA, and what the CNA do is take care of the physical aspect of the patient. So they'll feed the patient, they'll change the patient, help the patient to the bathroom. You may have to assist in that, but in general, it's like they have a lot of CNAs in nursing homes, and they do that. What your job is a lot of medication and documentation, like assessments. You're doing meds, so like the morning meds, the lunch meds, the before night meds, like it's just meds and meds and meds. It's like broken into shifts, so you could work from 3 to 11, 11 to 7, 7, like it keeps going like that. One thing about nursing home is that you have a lot of patients to yourself. For some reason in nursing homes, you could have like a 1 to 15 ratio or 1 to 20 ratio. I even seen 1 to 30 ratio. So it's not such a good ratio. Yes, your patients are stable for the most part, and when they're not, you send them to the hospital or get the doctor or nurse practitioner involved, but still, it's a lot of patients to take care of. The next type of job you could work in as a nurse is hospice. So hospice is providing end-of-life care for the terminally ill. This is a job that you either love or you hate. The one thing about it is that a lot of times you're caring for not just the patient, you're caring for their family. So you'll have family members who the patient wanted to be in hospice, the family member did not, or the family member just never came to terms with the patient dying, stuff like that. That's very sad to deal with, but you just have to be a certain type of personality to know how to deal with that. So the next type of job a nurse could work in is a nurse recruiter. So a nurse recruiter is like a regular recruiter. You're just finding nurses for the job. Usually it's someone with more experience who's been in that facility for a while, because you know the culture of the facility, you know what they want, you know what the floors are in that hospital or whatever it is. You are basically interviewing nurses, you are helping people get jobs, you are not dealing with patients at all, and just a different type of job if you like it. And the next type of job a nurse could do is a flight nurse. So flight nursing is, as the name says, it's basically taking care of patients in the helicopter, airplane, however they're transported. So it's usually a helicopter, and it's usually going to the hospital, someone who's basically severely ill, usually half dead, and they're bringing them to the hospital. It's very stressful. Some people love it. It's a lot of adrenaline, but it is very stressful, and you're doing everything like in the air. The next type of job a nurse could go into is forensic nursing. Forensic nursing is caring for victims of crime, assault, and usually works in medical examiner office. Like, for instance, a SANE nurse, which is a nurse who takes care of people who are sexually assaulted. Type of field that is pretty new, and if you like it, it could be great for you. So the next type of job a nurse could go into is research. Research nowadays is more like they want a master's, they want an MSN or something like that. But what they do is they do clinical trials, and you're basically interviewing people and writing down data and all that regular research. But with your BSN, you could do that. The job a nurse could do is infection control. So what infection control is that they're making sure that diseases are not spread, and how are they being spread throughout the hospital or facility. So usually nurses don't like people who are infection control because you're telling other nurses what to do. You're telling them, oh, they forgot a cap on top of this line, or, oh, you're not doing it correctly. It's a lot of educating. You're educating people on putting on PPE, on proper aseptic technique, and the like. Talking about educating, you could also be a nurse educator with the BSN. I know nowadays a lot of people do want MSNs, but a lot of places will take you with your BSN. And what that is that you're not dealing with patients at all. You're dealing with nurses. You're educating new nurses and skilled nurses. So you'll take equipment that they haven't used in a while. You'll show them the new equipment. You'll have skills validation. Anytime a new medication is used in that facility, you're going to educate them and make sure they sign off that they got educated, and make sure that they're up to date on their BLS, ACLS, whatever accreditation they need. The next type of job a nurse could do is a surgical first assist. What this is usually for a nurse who's been in the OR for a while. You do need an additional certificate, not a master's, just an additional certificate. And they're basically the first assist to a surgeon in the OR. The next type of job a nurse could do is telehealth nursing. As we all know, especially because of COVID, telehealth is on the rise. They basically use remote technology to assess and to provide medical advice to patients without actually physically being near them or seeing them. The next type of job a nurse could do is a case manager. So case management is kind of like social worker. You are basically planning from the admission to the discharge of the patient. You're planning resources for them, how they could go home. It's basically like a social worker. The next type of job a nurse could do is nurse consultant. What you're doing is that you're usually working for a lawyer. You are dealing with helping them bridge between the medical world and the law. And usually it's cases like medical malpractice, personal injuries, workers' comp, stuff like that. The next type of job a nurse could do is public health nursing. What this is you're not working with individual people. Instead, you're working with communities at large. So you're educating communities. You're seeing what the community needs to be able to live a healthy lifestyle. Yeah, you're just caring for the community. They could work in all different types of settings. They could work in a hospital, the government. They could work in a public school, non-for-profit, all different places. The next type of job a nurse could do is IT, like nurse informatics. These are usually people who are very techie, and they'll deal with like hospital network, making electronic health records safe and accessible for everybody, like that. The next type of job a nurse could do is holistic nursing. What this is you're basically caring for the whole of the person. Usually they'll use alternative treatments like non-medical treatments to help a patient. They'll do a lot of massaging, singing to the patient, herbs, like that. The next type of job a nurse could do is that they could work for insurance companies. Insurance companies need nurses for a lot of stuff: billing, medical coding, audits, etc. The next type of job is correctional nursing. So this is where you're caring. It's regular nursing. It's just that you're caring for inmates in usually a prison setting. It could be highly stressful, and some people find it scary and challenging. And last but not least, travel nursing. So travel nursing is generally you're filling in the shortage for hospitals or facilities that are short. So it could be in a nursing home, could be in a hospital, any place. They usually travel to 50 states. You're given a good salary, higher than regular, but you generally don't get so many benefits. You do get a stipend and money for a home and stuff like that. It's not the best for someone who has a family because you're running around and you're not settled. And you usually get 8 weeks or to 13 weeks assignments, and either the hospital will offer you a job and you could stay there, or you could just keep jumping around. Some people love it. You get to see all different places. Some people can't do it. They need their home, they need their family nearby, and it's not for them. All in all, that was a list of a lot of different job options for nurses to do besides for regular bedside nursing. If you have any questions, please leave it below. Please subscribe, like this video, and stay tuned for more.